it's good to be back here at CSA Medical Aesthetics. I'm Juliet Mirasol and I'm 48 years old. We're not aiming to stay young, instead we want to age gracefully. I believe it's okay to do something to improve how we look, not because we don't want to get old, but to boost our confidence when we look good and feel good about ourselves. As a beauty queen and a model, part of my job is to be on stage or in front of camera most of the time. So it's important for me that I always look my best. And today, Dr. Contessa will help me achieve that in a non-surgical, non-invasive procedure. What I love about Dr. Contessa is that she's very knowledgeable in what she does, so I'm confident that I'm in good hands. So don't forget to subscribe and click the notification bell.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up from our former guest. Let's all welcome back Miss Juliet Mirasol. Hi, Juliet.
Hello, Doc.
Wow.
It's great to see you again.
Great to see you again, too. So we did Botox and filler treatment for Juliet, and we can see a result right now. So how was it, Juliet?
Yes, I'm very happy, Doc.
Yeah. You look a lot younger, huh?
Yes,
Yeah.
thanks to you.
Okay, thanks to those products. So we did the upper third Botox treatment and then a part of the middle and the lower face, some filler injections there. And some people were really asking, like, those filler, are they safe? Or when you insert them, do they hurt? Or do they really last long? Are they really effective? Now you can see with Juliet, her experience during that time, she was okay, right? Very comfortable.
Yeah.
And the result is being seen right now, right?
Yes,
Yeah. By the way, like, when did you notice the full effect? Like, for example, with the Botox, with the filler.
Actually, after a week, Doc,
Yeah.
I can feel the effect.
Yeah. Me too, whenever I do my Botox third day, I can see results
There's
already.
lifting.
Plus the filler injections, you can see instant lifting. Plus, over time, you'll see more improvements with it. You'll see more of rejuvenation, especially with the hyaluronic. It hydrates your skin, it volumizes, and it really restores youthfulness, okay? And during that time, the pain was really tolerable, right? Okay, so it was a great experience. So for now, of course, we still wanted to do a treatment for you that will further enhance, of course, what we've done before. And it's like a part of the what we call the lifting treatment, rejuvenation treatment, and something that will also last longer. Because looking at Juliet, okay, she has a very beautiful face,
Wow,
right?
thank you, Doc.
So we're just wanting to maintain that beautiful and youthful look. Okay, if I assess, for example, the part of the mid face and the lower face, I explained to you a while ago that I noticed already tissue laxity, or there's like a loose part on the skin already. So, meaning to say the skin's elasticity, those collagen there, they're starting to get depleted or they're being, gradually they're not so much produced in the usual amount that we had them before. So the aging effect.
Thanks for
How young are you again, Mirza?
48.
See, so the aging effects on the skin, it's that the collagen gets depleted, elastin gets depleted, hyaluronic too gets depleted, and leading to this sagginess. And of course, it's like everything goes down. And with the pull of gravity, aside from the aging, okay? And lifestyle, healthy lifestyle, and I'm pretty sure you have good diet, good exercise, right?
I'm trying my best.
Yeah, because those are factors that we have to really consider whenever we wanted to take good care of ourselves. So for Juliet today, we want to do a basic treatment, I call it basic treatment, to somehow still lift those areas that you see they begin to sag or go down, okay? In the mid-face section, nasolabial, and also on the lower part, this jowl part here, creating this marionette line. So we still want to further lift it, because before we did the hyaluronic, right? Hyaluronic fills in any sunken part, hollow part. So there's some lifting, but we still wanted to further lift. So what kind of treatment, what procedure, we'll show you when CSA Medical Aesthetics return. And we're back, so we're doing a non-surgical facelifting procedure for Juliet. So the focus of our procedure for today will be the correction of the nasolabial area as well as the marionette and jowl. So the procedure that we will be doing will be the so-called COG lifting. Okay, so this will be PDO threads that will help in restoring that lifted tissues of our client today, Miss Juliet. Okay, Juliet. Okay, she heard the COG thread lifting. Okay, so don't worry, we'll be very gentle and we will make sure that your skin will be anesthetized. Okay, so before doing those kinds of lifting non-surgical procedures, of course, you do assessment. Okay, as to the assessment wise, we check on the the tissues that you would want to restore the original position. So like in this section here, so the mid-face area here, we wanted to do a mid-face lifting, nasolabial lifting together with the malar tissues here. So if you want to correct this, you can pull it towards the zygoma or even towards the temple region. Okay, so you wanted to do a pulling and as well as make this tighter, lifted, firmer for that rejuvenated look. So in the mid-face section, of course, you always have to consider anatomical landmarkings. So when we do a mid-face, so we know that the mid-face area is from this part here to the alar and tragus region. So that's our mid-face, okay? So when we restore this part here, the vector will be towards this temple region or the superior border of the zygoma, okay? And for now, the technique that I will be doing will be the COG lifting, 3 COGs here and 3 separate entry points. So it depends on what you want to achieve, like what shape of the face you would want to achieve, what kind of lifting or vector, so what is the concept, what would be the anatomical layer, those are the considerations. So for now, I wanted to do 3 separate entry points because I'll be using a different kind of a COG thread for today. And I also wanted to improve the skin texture of Miss Juliet, right, Juliet? Because you will notice she had these scars from acne before. Because this kind of COG lifting can stretch the skin and can make those remnants of acne, the scars, kind of like stretch. Plus the collagen stimulation will correct this too. So if I want to do 3 separate entry points and my end point will be the nasolabial region, I can make like 3 lines here, 1, 2, and a 3. Okay, so this is another method of doing your COG lifting, 3 separate lines, 3 separate entry points, plus this will be my end point here. So if I will use COG for Juliet today, I'll be directing it into the smash layer. So that will be my anatomical path. Now for structures that you want to avoid. Of course, at this region, we have, at this part here, we have the so-called superficial temporal vessel here. So we also have to avoid that. So you have to go like this. If this is within the 1 to 2 centimeter, then the entry point, you can try to avoid the 1 cm from the tragus and make your entry point like 2 to 3 cm anterior to it, okay? Now, in the midface section, we wanted to avoid, of course, you have the infraorbital foramen here and the zygomaticofacial vessel there. So those are structures you have to be very careful with. Plus, of course, some of the branches of your facial nerve. So as doctors, we are anatomists, we know the anatomical layer, we know which to avoid. Okay, Juliet?
Yeah.
So for mid-face, that's the landmarking, okay? Now, I will also do marionette lifting and jowl lifting. So marionette area here as well as the jowl here. If you want to lift this also, again, I can make use of my COG thread. Entry points will be here again. So 1, 2, 3. It's like 1 cm apart of those entry points, and make your diagonal line like that too. So this will be our basic COG thread lifting method for now. And we want to pull these tissues here towards this upper region here. Okay? So before doing any treatment, any injections in the face, we have to anesthetize. We put on like lidocaine cream, leave it for like half an hour to 45 minutes, and cleanse the area. Then I will also be injecting my local anesthesia in the entry point as well as the projection or the path of our COG threads there. So for the entry point, we will be injecting our local anesthesia here. So we have a lidocaine with epi here. So as to the entry point, you can go 2 to 3 centimeters anterior to the tragus of the ear, and then do a 1 centimeter apart for your entry point. So I'll be doing 6 COG threads for this right side of the face, and then we'll make use of a gauge 18 or gauge 19 needle to make a puncture of our entry point. And then we have a COG thread here. This is a 360-degree spiral COG type of thread, and then I'll glide it towards the first line. So we'll just follow the line that we did a while ago. So just glide it towards the nasolabial line. So for this part here, so previously I was doing a technique whereby I cross the nasolabial line. Now we can also like have an end point 1 cm lateral to your nasolabial line, just to pull the nasolabial tissue. So that will be enough, and I'll pull it out. And then second entry point, so 1 cm apart. And then second COG thread here, and then again, you direct it perpendicularly and then glide it. So follow your second diagonal line again. So the layer you can follow will be your fatty layer or SMAS layer. Okay. So Miss Juliet has thin tissues actually. So for her, we have to be very careful as to the anatomical placement. And then for my third COG, so she's okay because we were able to numb the skin. And then this is my third COG for my nasolabial lift. Okay. So one set for nasolabial lifting, 3 COG threads. So I'm using a 360-degree spiral COG. So I'm not crossing the nasolabial line, and I'm just gonna be 1 cm lateral to it and then pull it out. Okay. So for the last 3 COG threads, entry point again. So just follow the straight line here. So this is actually a basic technique for COG thread lifting. So on my marionette lifting, I have 3 diagonal lines again, and my COG is a spiral one, meaning to say the barbs or COGs are located spirally. So it's in a 360-degree rotation around the strand of that COG thread. Now for my marionette, I need to really cross the marionette line here. So normal to experience some resistance when you're near the line here, because we have the so-called mandibular ligament here, this part here. So just direct it there, and you can cross the marionette line. Second, for the marionette lifting, so 1 cm apart. There you go, and direct it perpendicularly, and then towards that marionette line again. So 1 cm interval, so you can cross your marionette line here and then pull out. And then the last COG for this marionette lifting here. So COG threads are for lifting, and they have different classifications as to the position of the barbs, the location of the barbs, the way they were manufactured, the thickness of the thread, and are they multi-directional, unidirectional, bidirectional. So those are different classifications of our COG. So cutting the remaining exposed threads here. So just minimal pull there, not too much. And then we can already do a movement towards the entry point. There you go. So we have done the right side of the face, so we'll proceed to the left side. So this is our final COG thread, the sixth one for the lower part of the face, marionette lift and jowl lift. Now we'll be cutting the remaining strands. Not much of a pulling there, just minimal tension. So just pull the strand and then drop off the iris scissor here. And there, last one, and we do the so-called massaging. So we have improved the sagginess. So I notice really some skin laxity. So we are tightening and firming the skin. So we just have to massage towards the posterior aspect of the face, towards the ear area. So we have done our basic COG lifting for Juliet. We'll show the result when CSA Medical Aesthetics returns. And we're back, so we'll now show the result to Miss Juliet. Here's our mirror, Juliet. There you go.
Wow.
So what we did for Juliet was the basic COG lift technique, whereby we did mid-face or nasolabial lift, as well as lower face or the so-called marionette and jowl lift. So we used a total of 12 COG threads for Juliet. So a while ago, we did an anesthesia whereby I also incorporated a so-called nerve block. I did infraorbital nerve block and the mentalis nerve block there. So up to now, Juliet still has this sensation of very numb around the mouth area. And for this kind of procedure, actually, you can see already an instant lift. So there's a reduction of the nasolabial fold as well as the marionette line, and there will be more improvements as time will pass by. And the laugh lines that Juliet had before will also be improved. So we were able to lift those tissues, the saggy tissues. We were able to reposition them and relocate them on the original top area where they should be, right? So this kind of COG lifting, okay, as you have seen the procedure a while ago, after that, you will expect some soft tissue swelling for like few days to a week. And then we advise them like avoid too much of that mouth movement. When you eat, you only eat soft food first, okay, soft diet for a week. And also like avoid dental appointments for the meantime, because we have these threads that are like limiting the movements around the mouth. And there's this normal sensation of the threads there. So we actually will give you like list of home instructions, do's and don'ts, what to do and not to do, okay? And then we'll also prescribe some prophylactic antibiotics and pain reliever if like there's discomfort, or like an anti-inflammatory medicine. Basically, that's it. And then we advise them to have a follow-up like 2 weeks later to check on symmetry of the face or balance of the face, because there are some individuals with inherent asymmetry. So usually after 2 weeks, we can correct that too. So Juliet, thank you so much. We're really so glad. I know she still has activities in few months time. Yeah,
September.
right? So somehow this is like something that's gonna boost your confidence more, help you in that journey you're into. Like we're so glad, we're so proud of you, like this kind of journey you're into. It's also for your self-development as well as for like women empowerment. Like us women. Okay, so thank you, Juliet.
Thank you so much, Doc.
I'll still see you for a follow.
Yes, Doc.
And thank you so much to all of you. For those who have questions, you may email us at csaskinclinic@yahoo.com. Our contact numbers 0933-860-9193 or 0917-504-4268. And also our social media accounts, Instagram, CSA Medical Aesthetics, and also FB, CSA Medical Aesthetics. So I think we could also follow Miss Juliet.
Mirasol.
Yes, her Instagram. Or some of you might want to ask, was it painful? Okay, she could just drop an answer, tolerable, something like that. Okay, and if you want to see her previous episode, just check our YouTube channel, Contessa Salvador Alapag. Okay, and by the way, our clinic, again, for those who are asking where is the clinic location, it's in the Infinity Shop, Pulong Maragul, Angeles City. Thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.